What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
Thank you, Richard. Yeah, that was a great start. I agree with Dick that Megan started us off well. And for those of you that are attorneys out there, Megan's graduating this year and looking for a job. So if you want an attorney who knows something about asbestos, think about hiring her. She's out in California. I'm here to talk to you about disease in Asia. And I've had the privilege, as you heard, for 45 years now. Privilege and you know, with a little sadness that we're still dealing with this problem after 45 years of study. When I was a young student, I was trying to think about, you know, what areas should I get interested in, because like very many naive young students, you think that issues are going to go away and there isn't going to be a career there. Well, I started working with Dr. Solikoff in 1968. It's 45 years ago, and I'm still interested in having to work in the subject of asbestos. Again, you know, you've heard that the Canadian mine is closed. That's a wonderful thing. You've heard about IARC and the troubles there, and you'll hear more about that. We have had some successes. Not only is the Canadian mine closed, but 50 countries in the world now ban asbestos. We're still not one of them. But my work over the years has taken me to a lot of parts of the world, including some work in Asia. And so if we could have the, I guess this is the slides. All right. Countries with significant use include India, Pakistan, Bangladesh, and China. Whereas other countries have stopped using asbestos, we still see a large amount of use in Asia. And what we see there and what we've learned there mirrors what went on in this country literally decades and decades ago. Previous major user in Asia had been Japan, but they've ceased using it. And there is a network to share knowledge throughout Asia that has been created in Japan. Our friend Ken Takahashi in Japan has pulled together the Asian Asbestos Conference a number of times over the years. I had the privilege of speaking at one of those, which was quite an honor, having been one of only 2 non-Asians asked to be there. So we know that they're changing from a major user with a lot of research having gone on in Japan to a country that is trying to educate its neighbors and the world about the hazards of asbestos. As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use. I remember being in Thailand with a colleague who said, we'd love to try to stop asbestos use here in Thailand, but one of the problems is that people point to the United States and say, you still use it in that country, America still uses it, why should we give it up when America hasn't done that? So it is clearly a major fight that we still have in this country that we need to continue to work at. Asbestos obviously has been known for a long time to cause disease. Linda showed you a slide with some history, and just to remind us, it's a little hard to see, but there's an asbestos body in the top right corner. That's a piece of tissue that Dr. Montague Murray cut after an autopsy he did in the year 1899. It was a young man who was about 36 years of age. He had been working at an asbestos textile plant in the East End of London, and he reported to Dr. Murray that he was one of 10 young men that had started working there 10 years before. And he was the 10th and last of those 10 young men to die, all of respiratory insufficiency. That, of course, was not known to be an asbestos body then. That took some years to figure out. But that's indeed what was on that tissue that goes back over a century ago. From Dr. Selikoff, we learned about the interactions of asbestos and smoking. Again, well known to many here, that if you smoke, you can get lung cancer. If you work with asbestos, you can get lung cancer. But the synergism of working with asbestos and smoking is far worse than either one by itself. Why is that important? Because Asia is still a big sales ground for the tobacco companies. When you still have rates of about 65% of Chinese males smoking with the large amount of asbestos use there, that is a serious problem in this country. I once did a back-of-the-envelope calculation and realized that there were going to be something like 30 million lung cancers in China over a relatively short period of time, and I can assure you the medical system over there is not well prepared to handle that. So whereas we have some modicum of rules and regulations in the United States, clearly with the world as it is, we're in a one-world market now. What about the standards of production? Well, they have to be high all over the world, but what about health and safety standards? That depends on what part of the world you work in. And so let me share with you some of the realities of what I've seen over in China. I've been going over there for more than 20 years doing research. I've published a number of papers with my colleagues there. Here's one of 3 asbestos factories that I'd studied. 2 women making brake shoes. They sell them to 40 countries in the world, including some that end up here in the United States. And they take the newly made brake shoes and buff them up so that they have a surface that will stop the car instead of being slick. And what they are wearing, of course, are cotton gauze masks, which is not going to keep asbestos fibers out. This was the part of the factory that made textiles. And again, the women are wearing cotton masks. This was an interesting factory, as you might imagine. This was the same place that made the brakes. There were different parts of this factory. The levels in that factory, which had been opened in the mid-1950s, had ranged as high as about 400 fibers per cc. The level in this country that's legally allowable now is 0.1, so let's put that into some kind of perspective. By the time I got there, this picture was taken in the early 90s. They were down in the single digits. They were so proud of getting from 400 down to about 4 or 5 fibers, but still far too high without any kind of ventilation or proper protection. This slide tells a whole story in one picture. The gentleman in the background in the white coat was the medical director at a factory in Shenyang, China. I visited there first in 1991. This picture was taken in 1993. He had been assigned as a young physician. The factory had opened in 1954. He got assigned to this factory as the medical director in 1956. So he had been there for literally decades by the time I got there to work with him. When I asked to see their old medical records, one of the things I found out was it was very hard to do research, at least in China, because there were no old records. If you left the plant or you died, your records got destroyed. So here we have rules about keeping records for 30 years after you leave a workplace. Nothing like that in China. He'd been scientifically interested enough that he'd kept his own personal notebook, and he had a record of 180 deaths from that factory, including the lung cancers and the mesotheliomas. So we knew that they existed, but it wasn't because of any official record keeping. It was his scientific interest. The gentleman in the foreground at the time was the dean of the School of Public Health in Beijing, went on to become head of their CDC in China, and is now a senior vice president at a medical school there. But the woman in the middle has her young daughter. It was a day off for her. She came in to do overtime. She had nobody to look after her 3-year-old daughter, so it was bring your daughter to work day, except it's at the asbestos factory. And so we had to educate them that this is something that we shouldn't really allow. So in this one picture, there's so many bits and pieces of this story and working there. Of course, we have the World Trade Center disaster that is near to our hearts, and we know what went on in New York. This was what Lower Manhattan looked like. So what happened to all those steel beams? 40 stories of one of the towers were loaded with asbestos. Those beams got sold to China and to India for recycling with the asbestos still on them. So the concept of controlled use certainly does not exist I'll just finish up with some work in India, a major country that still uses lots of asbestos. We can see this is one of their asbestos mines. This is what the factories look like. Some of the workers actually have respirators, but you see the man in the lower right. You see this woman with her gauze across her face, or her sari, or parts of it, dumping raw asbestos into a hopper. The pipes that come out with the asbestos on it. Shipbreaking is a whole other issue. Pakistan, India, Bangladesh all do shipbreaking and they rip out the asbestos. Asia is a major area of concern, and things are being made more difficult by IR. And so with that, and my time being up, I will finish and share with you that we still have much to do in other parts of the world as well. Thank you very much.
Thank